Chers amis, nous allons reprendre la session que nous avons dû interrompre pour une question d'organisation. Donc, sans plus attendre, je vais donner la parole à professeur Morgan Cheati d'Afrique du Sud, qui est le vice-président d'African Global Health. Et nous allons être très courts avant de pouvoir entamer le panel ministériel qui vient juste après. Merci beaucoup. Je donne la parole à professeur Morgan Cheati.
Your Excellency, esteemed guests, ladies and gentlemen, let me start as well and express my condolences to all of those who lost dear friends, family, and dear ones. My objective this afternoon, I would like to reflect on the Marrakesh Declaration and the Harm Reduction Charter. I want to take you through a journey as quick as I can from November 22nd, 2022 to where we are today. The Charter is a very ambitious attempt to make the continent of Africa safe and a platform for access to quality health care. Why do I call this ambitious? It's ambitious because this particular initiative is very innovative, it's very brave, and I must compliment the people behind who put this together in the sense that they looked beyond challenges and they looked at the opportunities that we have. We are cognizant that the demographics and that the epidemiology of the areas varies. The Charter will guide us to establish a uniformity in Africa by a fit-for-purpose set of policies, and it will help achieve a very resilient public health platform free of harm and for all those who seek health care. So the Charter that we created is a living document, as you heard already, and the Charter has been changed due to a number of iterations because the scientific committee has toured Africa and taken input and adopted certain recommendations. The Declaration of 2022 ushers in the Pan-African Charter for harm reduction based on a multi-stakeholder debate, dialogue, and vision. The conference brought together 120 experts and 800 high-ranking delegates from Africa and globally to deliberate on health risks and the hazards of health. The Charter endorsed the need for a public harm intervention, but being cognizant of the need for global dialogue. The Harm Reduction Charter in Marrakesh in November 22nd, 2022 endorsed a set of principles that promotes universal harm reduction as a conceptual framework for healthcare provision. The Charter is a culmination of the work of experts who, through their experience, guided by the environmental demographics, formulated the Charter. The participants were from 60 countries, and amongst the delegates were government officials, healthcare practitioners, scientists, researchers, media representatives, and civil society. In formulating the Charter, it included the impact of the COVID-19 pandemic in its context and the potential impact of global humanity reaching the 8 billion mark. The Charter was further guided by the fact that accessible, quality, and affordable health care is a key reach for the United Nations Sustainable Development Goal in general by 2030. It also emphasizes two other aspects of the SDGs. Goal number 3, which advocates for good health and well-being, and goal number 3.8 that advocates for universal health coverage. There was the need to assess and to evaluate the health systems in relation to the innovations, digital inclusion, financing, policy reforms, social considerations, including the social determinants of health. With health system strengthening, it was necessary to provide a sustainable, resilient platform, which is the capacity to consistently maintain a safe state. Such systems will have the capacity to anticipate problems, use data, monitor, process, and respond to the signals in anticipation of perceived challenges. The advocacy for safety is a hallmark of this charter. The global advocacy in recent years has culminated in the adoption by the 72nd World Assembly in 2019 of Resolution WHA 72.6 on the Global Action Plan on Patient Safety. This resolution specifies the need for a safe as a prerequisite for universal health coverage. The participation of experts was concerned by the lack of adequate resources, the poor infrastructure, the low healthcare literacy, and the low level of cooperation from richer countries to the South-South demographies, as was witnessed during the COVID-19 crisis. The Charter also highlights intervention based on multi-sectorial collaboration, future scientific research to develop policies, to reduce the health risks and the preparedness for disasters, and to promote health as a human right. The United Nations legislatively embodied the economic and social parameters of its right in the International Covenant on Economic, Social, and Cultural Rights, which elaborates the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. So the conference concluded with this set of 14 recommendations, and this served as the first draft of the Pan-African Charter on Harm Reduction. Finishing up. The document, as stated, has been changed. The Charter also steered the way for the second Harm Reduction Conference and the first South-South Harm Reduction Conference in Marrakesh. So what's the intention of this particular project? The project, as enunciated by myself now, we seek to find an African solution for the needs of Africa. And the 2023 conference endorses the need for an African global health and includes the SDG targets of food security, water security, and the environmental issues, which includes climate change. We have a vision for a new future to health in Africa and globally. We cannot wait, nor we have the luxury for the future to arrive. We need to co-create this future together now. Thank you.
So, thank you, Professor Chetty. Merci, Professeur Chetty. Je vais donner maintenant la parole. Excusez-moi. Alors, on n'a pas posé le bon papier. Le panel, je sais, dans le panel. So the ministers, les ministres vont nous rejoindre dans un petit moment. Nous allons aller un peu plus rapidement. Je vais sans plus attendre, si vous permettez, même si la salle n'est pas encore pleine, je vais appeler le docteur Ahmed Ougme Ouma, s'il vous plaît. Merci beaucoup. De Africa CDC, qui nous fait l'honneur d'être là et qui est notre DG d'Africa CDC. Merci beaucoup.
Thank you. Thank you very much to the Director of Ceremonies. First is to recognize the presence of His Excellency, the head of the Moroccan government, Aziz Khanouch, who graced us with his presence here today. The Honorable Minister of Health and the Honorable Minister of Agriculture of Morocco as well. To all my fellow panelists who are sitting here, Excellencies, the Honorable Ministers who are present here with us from different countries, His Excellency Dr. Tedros, the Director General of the World Health Organization, distinguished speakers, panelists, delegates, ladies and gentlemen. First, I would like to extend my most sincere condolences to the people and the Kingdom of Morocco, particularly all those who've been affected by the tragedy of the earthquake recently, and we pray for all those who are affected to get relief, inshallah. Excellencies, ladies and gentlemen, I would also like to thank the Honorable Minister and the organizers of this particular conference for inviting the Africa CDC to participate in this very important conference, and it is my honor to join you today for the second edition of the African and the first edition of the South-South Health Harm Reduction Conference. The theme this year, Health in Africa, Water, Environment, and Food Security, is timely because during these difficult times or when climate change is increasingly disrupting our ways of life, it is important that we put these discussions at the center of our forums, wherever it is that we hold them. Reducing the risks to ill health is really the best way for Africa to handle the multiple disease threats that our citizens continue to face. Health harm reduction is therefore the most viable option considering the limited resources that we have here on the continent of Africa. When we come together to share experiences, it enables us to learn from each other. It enables us to adapt strategies and solutions that will work for us in the global South. This South-South dialogue, therefore, comes at a crucial time for our resource-constrained countries. I would like to congratulate all those who have put together this very important initiative. Excellencies, ladies and gentlemen, I would like to share with you three messages today: on indigenous knowledge, on documentation of our experiences, and on taking action with visible results. Let me start by acknowledging that Africa and many parts of the global South, we are made up of ancient civilizations. Indeed, it is common knowledge that humanity started here on the continent of Africa. Our communities, spread across the different countries, have been handling issues of water, of food security, and the environment for hundreds of years, using local knowledge, experience, and expertise. Our ancient communities did not become extinct, and this is certainly a sign that they handled these issues well and with success, and that is why they continue to be here in this world. This indigenous and local knowledge is therefore valuable in how we strategize and execute our plans for today and for the future. I would like to persuade you that one of the missing links in addressing our health harm reduction strategies is the slow uptake and use of our indigenous and local knowledge. This, ladies and gentlemen, must change. Secondly, we generate a lot of information and data in Africa. Indeed, we generate a lot of information and data in the global south. This information, when well analyzed, can be the source of a lot of evidence on what works and what can make a difference in our efforts to protect our continent, to protect our world from disease threats and other social and environmental challenges. However, we do not yet effectively document this evidence, and unfortunately, we also do not consistently use this evidence when we are doing our planning and execution. We keep quoting evidence from elsewhere in the world, and this results in a gap in what can really work here in Africa, a gap in what can really work in the global south. This too, ladies and gentlemen, must change. Thirdly, we have created multiple opportunities and forums to discuss and highlight the problems and challenges that Africa and the global south continues to face in terms of challenges to health risks. We on the continent and the rest of the world need a stabilizing factor to the challenges that we face, particularly at community level. It is time to expand our discussions into action. It is time for positive action that will translate into better health and a better environment for our people. Indeed, it is time to take these discussions to the communities, where the real action must take place for us to achieve success. It is time to step out of these meeting halls into our villages, into our forests, into our lakes and rivers, to make the real difference that this continent and this world currently needs. It is indeed time to take action that gives us the most visible results. Excellencies, ladies and gentlemen, human health is the face of the success or failure of our harm reduction strategies. The reality is that the solutions, and I repeat what other panelists and speakers have said today, the reality is that the solution for African problems will come from Africans. And the solutions for the South must come from us who live here in the global South. To achieve this success, you will find Africa CDC and the Africa Union to be true local partners and strong advocates for local solutions. May this first edition of the South-South Health Harm Reduction Conference be the beginning of a movement that uses our local knowledge and expertise to address our water, environment, and food security gaps here in the Africa and beyond. And I thank you, ladies and gentlemen, for your attention.
Thank you, merci beaucoup, merci pour le support représenté aujourd'hui par notre ami de Africa CDC et de l'Union africaine qui sont présents aujourd'hui avec nous. C'est un honneur et un plaisir. Sans plus attendre, nous allons démarrer le panel ministériel qui sera présidé par notre ministre de la Santé et de la Protection sociale, monsieur professeur Khalid Aitaleb, et monsieur le ministre de l'Agriculture, monsieur professeur Sadeghi, donc du Maroc. Le panel ministériel, je vais demander à mesdames et messieurs les ministres de la Santé et de l'Agriculture de nous rejoindre sur l'estrade, s'il vous plaît, et remercier nos orateurs. Notre keynote speaker, le docteur Taker d'African Health Business, sera avec nous dans le panel juste après pour pouvoir parler plus amplement et avoir la session qu'il devait avoir avec nous et avoir le temps pour discuter et parler de l'esprit et de la vision et de la résolution avec le docteur Tendai Misa. Merci. Donc, pour reprendre, nous avons, messieurs les ministres de la Santé et de la Protection sociale, professeur Khalid Aitaleb, et le ministre de l'Agriculture, professeur Sadeghi, qui sont là avec nous, qui vont présider cette séance ministérielle qui est articulée exactement comme toutes les autres tables rondes, avec la présence d'éminents et d'honorables ministres de l'Agriculture et de la Santé, avec comme secrétaire de séance le docteur Sarat Wirsi pour prendre les notes, et comme juriste de séance le maître Bekouchi Selima. Merci infiniment. Sans plus attendre, nous allons demander aux honorables ministres de nous rejoindre sur scène. Merci. Je vais ainsi donner la parole à professeur Khalid Aitaleb, qui est ministre de la Santé et de la Protection sociale. Et comme nous le savons, le Maroc aujourd'hui est en pleine réforme, une très grande réforme. Des choses extraordinaires sont en train de se produire en matière de protection sociale et de santé. Donc je vais donner à Monsieur le Président, si vous voulez, si vous voulez.
Merci Madame la Présidente de l'Association Global Health, d'African Global Health. Monsieur le Ministre, Messieurs les ministres, Messieurs les ambassadeurs, chers amis, confrères, collègues, Excellences, je vous souhaite la bienvenue. Je vous souhaite la bienvenue à Marrakech pendant cette période douloureuse, cette conjoncture que nous vivons au Maroc. Je vous remercie énormément parce que je considère que votre présence aujourd'hui est un soutien énorme pour le Maroc. De quoi je vais parler aujourd'hui? On va parler de la réduction des risques. Tout le monde a compris qu'est-ce que c'est que la réduction des risques. C'est notre deuxième édition. L'an dernier, nous avons réussi quand même la conférence en novembre 2022. On a parlé bien sûr de certaines thématiques intéressantes, surtout les défis technologiques. Aujourd'hui, nous sommes en train de parler de l'eau, l'environnement, la sécurité alimentaire. Et nous avons profité de l'occasion pour éventuellement parler aussi des catastrophes naturelles. Est-ce qu'il est toujours temps de continuer à parler de la réduction des risques? Puisque tout le monde a compris qu'est-ce que c'est que la réduction des risques. Sa Majesté n'a pas cessé d'interpeller et d'appeler, bien sûr, à une convergence des politiques publiques, éventuellement en matière de santé. Et ça, vous le comprenez très très bien, que la santé est une question centrale. Et aujourd'hui, la réduction de risques est aussi transversale. Et on a bien compris que la réduction de risques nécessite quand même une certaine harmonie entre les différentes politiques publiques. La santé est une question qui quand même qui sera affectée prochainement par des défis de taille et pour lesquels il faudrait apporter des solutions rapidement. Si je parle bien sûr des défis de taille, parce que je fais allusion essentiellement aux différentes mutations que nous assistons sur le terrain, notamment par rapport aux progrès technologiques. Et ces progrès technologiques impactent sur le panier de soins et sur le coût de soins. Et qu'aucune assurance maladie, dans le futur, ne pourra bien sûr supporter les dépenses en santé. Aucune finance publique n'aura la possibilité de supporter ça. Et donc la meilleure solution aujourd'hui, c'est comment développer cette résilience au vu bien sûr des défis de taille du futur, s'il n'y a pas une réduction des risques. Et c'est la raison pour laquelle il faudrait que le continent africain, aujourd'hui, passe à l'action. L'heure de l'Afrique a sonné. Je parle en présence du CDC africain et mon ami qui est présent devant moi. On s'est rencontrés à Kigali, on a parlé de cette question. On a parlé de la réduction des risques. Vous vous rappelez? Donc, l'Afrique n'a pas le temps encore à attendre. Toute minute passée, bien sûr, est un retard avec un effet multiplicateur. La gestion des crises on en connaît les impacts. La gestion des catastrophes, on en connaît les impacts. Vous savez, nous sommes passés par une crise sanitaire mondiale dans laquelle le continent africain avait quand même subi une certaine inégalité, une certaine discrimination. Est-ce qu'on doit encore revivre ce phénomène-là? Loin de là. Il faut que l'Afrique, grâce aux efforts que fait le CDC aujourd'hui, pour essayer d'apporter quand même la coordination. Parce que ce qui importe aujourd'hui, chaque pays dans l'Afrique, il a son potentiel, il a son contexte. Mais malheureusement, il n'y a pas encore une très bonne convergence. Et c'est pour cela que ces rencontres sont intéressantes. C'est pour essayer d'apporter quand même des solutions à certaines problématiques. Et la grande solution aujourd'hui, si on arrive à sortir avec une feuille de route qui pourrait être quand même le socle qui débouchera sur une charte continentale pour pouvoir parler de souveraineté sanitaire. Une souveraineté sanitaire ne saurait exister s'il n'y a pas une réponse à la question de l'eau, s'il n'y a pas une réponse à la question, bien sûr, de l'environnement, s'il n'y a pas une réponse à la sécurité alimentaire. Le continent africain, c'est le continent le plus jeune qui existe aujourd'hui. Les 8 milliards que nous avions atteints l'an dernier, c'est par rapport au taux de fécondité africain. C'est le continent africain qui est le taux de fécondité le plus élevé. Et c'est la population la plus active et qui reste la plus jeune. Donc, elle doit réussir le projet de la protection sociale. Le continent africain doit être le pionnier dans la protection sociale grâce à cette richesse. Nous ne devons pas rester quand même un continent qui exporte la ressource humaine parce que toute notre richesse aujourd'hui, elle réside dans la ressource humaine. Et ce potentiel-là, il faut le multiplier, il faut essayer quand même de le mutualiser pour que l'on puisse sortir avec des réponses à ces questions, à ces problématiques du terrain. C'est pour cela, bon, la technologie qui changera le métier de la santé, et ça vous le connaissez très bien. La médecine ne sera plus une médecine curative, comme on peut l'entendre. C'est une médecine qui va être demain personnalisée. C'est une médecine qui utilisera plus de génomique, de métabolomique. Et c'est une médecine qui va coûter trop cher pour les finances des pays. Et donc, qu'est-ce qu'il faudrait faire? Il faudrait travailler la main dans la main pour essayer d'avoir une seule vision dans la réduction des risques, car Sa Majesté a dit dans une citation que l'Afrique peut compter sur l'Afrique. Et donc, puisque l'Afrique peut compter sur l'Afrique, l'heure de l'Afrique a sonné, il faudrait passer à l'action. Voilà, vive l'Afrique. Merci beaucoup.
Alors, j'ai l'honneur de présenter le professeur Sadiki qui va vous dire son mot également.
Bismillahirrahmanirrahim. Tout d'abord, je voudrais me joindre à mon collègue et ami pour vous souhaiter la bienvenue et je vous remercie d'avoir répondu à notre invitation. Alors, la thématique de cet atelier concerne les écosystèmes de demain et puis toute la question de coopération et de partenariat. Mais comme nous l'avons déjà entendu dans l'ouverture par le chef de gouvernement et puis dans les ateliers passés, notre continent africain, tout en étant une terre qui est riche en ressources, fait face à de nombreux défis en matière de santé, évidemment, comme ça vient d'être exposé par mon collègue et ami, et qui nécessite une attention urgente spécifique par rapport à la disponibilité durable d'une alimentation qui soit saine, nutritive et d'un écosystème durable et résilient. Bien sûr, les questions liées à l'environnement, au climat et à la perte de la biodiversité ne cessent de nous interpeller depuis longtemps, mais de plus en plus avec le contexte que nous vivons depuis 3 ans. Les écosystèmes à l'échelle mondiale et particulièrement la richesse biodiversité écologique de l'Afrique sont en déclin, ce qui menace des millions de moyens de subsistance, accroît l'insécurité alimentaire et les conflits pour les terres, développe le risque de l'apparition de nouvelles épidémies dues à la transmission des maladies zoonotiques. Les pratiques non adaptées en matière d'agriculture, d'exploitation minière, d'exploitation forestière et de pêche sont les principaux moteurs du déclin de la biodiversité, voire des écosystèmes en Afrique avec des pertes constantes d'espèces et d'habitats. Le changement climatique vient exacerber la détérioration donc, de ces écosystèmes. L'ampleur des défis évolutifs auxquels fait face l'écosystème africain et mondial et la pression de la demande mondiale pour la sécurité alimentaire sont disproportionnés par rapport aux efforts consentis par le continent dans la mise en œuvre des différentes actions à cet égard dans différents cadres. Et je voudrais juste insister sur le fait qu'aujourd'hui, on peut synthétiser toute la problématique et toutes les problématiques que nous vivons et que pose de manière claire cette conférence, le titre de cette conférence, l'eau, je dirais le nexus eau, environnement, sécurité alimentaire en relation avec la santé, en termes d'abord de disponibilité et de solutions par rapport à la question de sécurité alimentaire. Donc l'équation est simple mais très complexe à résoudre. C'est de pouvoir faire plus avec beaucoup moins en termes de ressources, notamment la ressource sol et la ressource hydrique. Et donc c'est le challenge le plus important qui se pose à notre continent. Et nous sommes tous invités pour des efforts supplémentaires, parce que ce qu'on fait aujourd'hui, il est bien, nous sommes sur certains volets sur la bonne voie, dans certaines politiques publiques sur la bonne voie, mais ce n'est pas suffisant. Et des efforts supplémentaires via le renforcement notamment de la coopération Sud-Sud pour de nouvelles approches stratégiques communes en vue de promouvoir un avenir innovant pour l'Afrique, en particulier à travers un certain nombre d'actions. Je cite premièrement la préservation de la biodiversité via des efforts en matière de gestion durable des terres, de forêts, d'océans et d'écotourisme, le développement d'une agriculture résiliente en privilégiant le développement économique inclusif et les emplois verts, la concentration sur la préservation de l'eau en améliorant l'information, la communication et les technologies, notamment via la promotion des villes vertes et résilientes et la bonne gouvernance des ressources en eau pour faire face au stress hydrique, la promotion du développement des énergies renouvelables, de l'efficacité énergétique et des programmes nationaux de transition équitable, et puis l'augmentation des flux, l'efficacité de l'impact du financement climatique. Mesdames et messieurs, conscient de l'importance de ce défi, je voudrais parler de l'expérience du Royaume du Maroc. Le Maroc s'est fortement engagé en faveur d'une agriculture africaine durable et compétitive, notamment à travers une coopération basée sur le partage des expériences entre pays partenaires afin d'asseoir une solidarité et une dynamique commune pour faire face aux défis humanitaires, climatiques, alimentaires et sanitaires. Alors, notre expérience de collaboration avec les pays du Sud et du Nord nous a mené à développer une vision stratégique d'une coopération internationale tangible qui s'articule autour de projets innovants qui prennent en compte les besoins en agriculture, ainsi que l'ensemble des acteurs du système alimentaire dans notre pays, tenant compte de la fragilité des écosystèmes et la résilience et durabilité de la production agricole au niveau de notre pays et ceux des pays partenaires en Afrique. Cela nous interpelle tous, chacun dans son pays, sur les challenges et les moyens à relever en matière de coopération et de collaboration avec les partenaires internationaux, pays du Sud, pays du Nord, bailleurs de fonds, agences de coopération technique, pour mettre en place des politiques agricoles résilientes, durables, inclusives et adaptées aux spécificités de nos territoires et nos régions. Au Royaume du Maroc, nous sommes enthousiastes aujourd'hui de compter des projets concrets de coopération avec plus d'une trentaine de pays d'Afrique, de Caraïbes, d'Amérique latine. Et notre priorité est de développer des programmes qui capitalisent sur les expériences des pays partenaires, de transmettre notre savoir-faire et des bonnes pratiques, notamment en matière d'irrigation, de formation, de recherche agricole, d'établissement des cartes de fertilité et de développement des chaînes de valeur animale et végétale. La ligne directrice de la dynamique de cette coopération réussie a été construite sur la dynamique nationale de coopération Sud-Sud et d'intégration régionale conduite par Sa Majesté le Roi, que Dieu l'assiste, sur la base des politiques nationales pour le développement de l'agriculture, en l'occurrence le plan Maroc vert, et le plan Génération Green, la stratégie nationale de développement rural, stratégie de développement du secteur de la pêche halieutique et stratégie de développement des forêts du Maroc. Alors aujourd'hui, ce panel permet d'approfondir la réflexion sur les questions liées à la préservation et le renforcement des écosystèmes de l'Afrique de demain, notamment la préservation et la résilience de ces écosystèmes avec toutes leurs composantes, et ces composantes sont nombreuses, devant les défis de l'insécurité alimentaire et la malnutrition, face aux pratiques adoptées au niveau des systèmes alimentaires et des chaînes de valeur actuelles qui ont perdu leurs équilibres suite donc aux différentes crises multifactorielles, à la préservation de l'environnement et le climat et la biodiversité. Et je vous remercie.
Merci, Messieurs les ministres, merci, Messieurs les présidents. Sans plus attendre, je vais appeler Messieurs les ministres, Monsieur le ministre Avi Dichter d'Israël de nous rejoindre, ministre de l'Agriculture et du Développement rural, Madame la ministre Hanifa Kawoya Banjirana de l'Ouganda, ministre de la Santé de l'Ouganda, Monsieur le ministre Samuel Dalitso Kawale, ministre de l'Agriculture du Malawi, Monsieur le ministre Douglas Mombeshora, ministre de la Santé du Zimbabwe, et Madame la ministre Halima Halima, ministre déléguée à la Santé du Malawi. Merci infiniment de nous rejoindre sur la scène afin que nous puissions démarrer cette session et ce panel ministériel. Sans plus attendre, et pour des raisons de logistique importantes, puisqu'il va devoir nous quitter, bien que nous aimerions qu'il reste avec nous, je vais donner la parole à Monsieur le ministre de l'Agriculture d'Israël. Merci infiniment.
Honorable ministers, esteemed colleagues and guests, I'm honored to join you here today at this important international conference on health, harm reduction, water, environment, and food security. 20 days ago, a powerful and devastating earthquake struck this region just 70 kilometers southwest from our current location. This catastrophic event resulted in the loss of thousands of lives, injuries, and displacement of many from their homes. First and foremost, I want to extend my deepest condolences to the Moroccan people and the kingdom's authorities who are dealing with this tragedy. These challenging times call for unity and support. I also want to express my sincere appreciation to our hosts, تحيات جلالة الملك محمد السادس نصره الله, and the government of the Kingdom of Morocco, represented by Professor Mohammed Sadiqi, Minister of Agriculture, Maritime Fisheries, Rural Development, Water and Forestry, and Professor Khalid Talib, Minister of Health and Social Protection, for the remarkable efforts in organizing this conference. Your kind hospitality is highly appreciated, and I congratulate you for this important event. As we gather here, we set aside consideration of religion and nationality, recognizing that we all share a common purpose, addressing the pressing global challenge of ensuring the good health and well-being of our people and our nations. By 2050, the global population is expected to reach 10 billion. FAO stated that in 2030, 6 years from now, we'll have 600 million people under starvation worldwide. 600 million people. Along with the ongoing climate crisis affecting our ecosystems and livelihoods, addressing food security is a challenge we must embrace and work to resolve. Climate crisis is already presenting one of the biggest threats to global economy and to human well-being. We therefore must understand that we have reached the point where we must learn to live in a constantly changing climate. We must do it now, and we must do it collectively. Recognizing that nutrition is a vital aspect of both health and development, one of the primary responsibilities of the agricultural sector is to guarantee a safe, nutritious, and reliable food supply. Food systems are especially vulnerable to natural disasters and extreme weather events. It puts pressures on our ability to grow crops, raise animals, and earn a living as we were previously accustomed to. Competition for limited natural resources, such as land, water, and energy, combined with food and water shortages, will deepen social inequalities, drive migrations, and create geopolitical tensions. These are challenges we all face together, and we must address them collectively. When Israel was established 75 years ago, our seminal ethos was to be self-sufficient and to stand strong in times of need. We are forced to use our limited natural resources to ensure a high degree of self-supply, although half of our land is desert soil that never been cultivated before. The good news is that we have succeeded and turned our challenges into opportunities. The current global crisis is an opportunity to harness governments as well as experts and researchers to join hands. Right after joining hands, to collaborate internationally among themselves and alongside private enterprises. Let's come together and build partnership, working both as a collective, as individuals, to path a way forward towards a better future where food security is a reality for all. It is time that decision makers like us will look forward for a joint solution-oriented vision that will enable us to address the major challenges we now face. I believe that by collectively sharing our experiences and knowledge, we can create a platform for the mutual exchange of information that will spark innovative, out-of-the-box solutions and practices that will make a valuable contribution to global food security. In Israel, over 75 years of independence, we succeeded in overcoming geopolitical, geographical, and climatic challenges to establish a thriving agricultural sector. The high standard of development in the sector can be credited to close cooperation and interaction between, first, scientists, second, extension services, third, farmers, and four, innovative agro-agriculture and agro-industries. These four elements have joined together to transform agriculture in Israel into an industry that is globally renowned for its innovation. Necessity has been the catalyst for remarkable innovation. State-of-the-art water treatment facilities have revolutionized agricultural irrigation, driving us towards water security in one of the world's climate change hotspots. Innovations combined with advanced water management techniques have enabled us to increase the amount of water, of fresh water, that we provide our neighbors for their needs. In light of the geopolitical and environmental context in our region, Israel has established an emergency authority with the primary goal of ensuring a continuous supply of water and food for its people, while also considering the agricultural sector's requirements. The importance of storing dry agricultural produce has been recognized for thousands of years, as it provides extended food security and marketing flexibility. However, during storage, the quality and quantity of the stored grains may be damaged. Israel has been able to minimize the reduction with less than 0.5% loss, while developing countries experience 4 to 20% losses, and developed countries 1 to 5% losses. Research led by the Ministry of Agriculture in Israel achieved significant success. Expertise and collaboration with storekeepers, exterminators, and the supervision system of the ministry brought the loss of grains to 0.5%. My dear friends, Israel's commitment to sustainable agriculture, paired with the innovative spirit, has led to solutions that could help reshape and ensure the future of global food security. We are ready to share our experience and accumulated know-how. We commit to working together and sharing knowledge, harnessing these innovations to improve agricultural practices on global scale. Together, by joining the professional strengths of each and every nation, we can take a significant leap forward in our joint mission to achieve food security for all of our people, for all of our nations. Similar to Israel, each country represented here today possesses its own unique areas of expertise. Let's come together and combine our efforts. Let's set an example as a region situated at the core of one of the world climate hotspots for unique cooperation to ensure a healthy and continuous food supply to our people at all times. Thank you very much.
Merci infiniment, Monsieur le Ministre. Je rappelle que Monsieur le Ministre a des contraintes d'agenda et qu'il va devoir nous quitter parce qu'il doit retourner en Israël. Nous le remercions infiniment de l'honneur qu'il nous a fait d'être présent avec nous. Alors, sans plus attendre, je vais donner la parole à Madame la Ministre, Madame Hanifa Kaoua Banjirana de l'Ouganda, qui est ministre de la Santé et qui est avec nous aujourd'hui, qui nous fait l'honneur d'être avec nous aujourd'hui.
Your Excellency, the Minister of Health, Your Excellency, the Minister of Culture, Your Excellencies, all distinguished participants, I stand on all protocol. Assalamu alaikum wa rahmatullahi wa barakatuh. I want, first of all, to thank the organizers and the sponsors of this important conference, especially His Majesty, the King of the Kingdom of Morocco. May God assist him and glorify him. I want to thank the Minister of Health, Minister of Agriculture, the African Global Health Association, and AHA for this very insightful event and conference. I'm very grateful on behalf of my country, Uganda, that I bring warm greetings from the Republic of Uganda and His Excellency, the President. I once again want to thank you for inviting me to attend the important conference and for allowing me to make some remarks during these panel discussions. Shukran, Jazira, merci beaucoup. Once again, I want to say that I want to deliver my remarks before I need to convey our sympathies and condolences to the kingdom and the people of Morocco for the loss of life and suffering caused by the earthquake. We stand with you and we are with you. We know many sisters of ours and brothers, they lost their lives, and may the souls of your brothers and sisters rest in eternal peace, and we wish the survivors quick recovery, and wish the country to move on to this challenging moment. COVID-19 pandemic taught us that we need each other in one ecosystem if we are to shape and strengthen Africa's health systems. When we met in South Africa, Johannesburg, we emphasized the 5 pillars of new public order for Africa as championed by the African Union and CDC. In Johannesburg, we also agree that no single member country or state will be able to achieve the new public order alone. We need to come together and we work together. I'm here because you are here, and we are all here to walk together that talk. As we discuss the ecosystem and how to prevent harm to harm, we need to appreciate how we interact with our environment. Human beings are part and parcel of the ecosystem. Ecosystems are the planet's life support for human species and all other forms of life. Human health and livelihood sustainability depends on functional ecosystems. Ecosystems support our people, many of whom rely on natural resources for their livelihoods and cultivation, as has been said afore. Harm reduction and ecosystems conservation are closely linked, and if well balanced, could offer the much needed sustainable development for the current and future generations. It's also important to note that the pillars of sustainable development and the determinants of health rotate around the environment, society, and economic sustainability. This is interconnectedness between ecosystems, human health, socio-economic development, all should be our greater opportunity for us to harness and reduce catastrophic harm on human beings and environment. The negative impact on ecosystems has corresponding impact on the human health, and this can be evidenced from the emerging and re-emerging pandemics. This meeting is therefore an important opportunity for us to collectively think of innovative ways to tackle the current ecosystem challenges with a focus on harm reduction to foster public health and social economic development. It is therefore important to encourage states to develop and operationalize public health policies intended to reduce the negative impact of ecosystems and reduce harm to human beings. As countries, we can only achieve this by engaging all stakeholders across the spectrum of effective ownership, appreciation, and smooth adoptions. Countries also need to allocate adequate funding to implement policies that will protect environment and ecosystems. It is, however, projected that agricultural productions and food security will be severely compromised by climate change. And in managing and maintaining this, there is a need to integrate ecosystems of the good services and in the agricultural products. Finally, let us use the South-South cooperation as a tool to collaborate and share knowledge, skills, and successful initiatives in specific areas such as agricultural development, human rights, urbanization, health, and climate change. I'm therefore very happy that Africa is coming together to work as one continent. This will make Africa better prepared effectively to respond to any disease or any pandemic. I'm very happy for the Kingdom and the Ministry of Health for your continuous striving to ensure as Africans we come together and we tackle these issues, which are African issues, and we are the ones to tackle them on our own. Uganda is committed to be part of this family, to ensuring a strong collaboration, partnership, as we strive for healthier and a safer planet. I thank you all. I look forward to fruitful deliberations. I thank you.
Thank you, Honorable. Alors, je vais sans plus attendre appeler Monsieur le ministre Samuel Dalitso Kawale, ministre de l'Agriculture du Malawi, s'il vous plaît.
First of all, Your Excellency, the President of the Republic of Malawi, Dr. Lazarus Chakwera, and the people of Malawi would like to send their condolences to His Majesty King Mohammed VI and the people of Morocco for the loss of life and property during the earthquake that took place a few weeks ago. We would like to assure you that the prayers of the people of Malawi are with you as you go through this difficult time. Malawi has faced numerous challenges on its journey towards achieving food and nutrition security. Despite being predominantly agro-based economy, we have also struggled with issues of climate change and a growing population, which have put pressure on its ability to ensure a consistent as well as nutritious food supply chain for its citizens. The majority of the population, they depend on agriculture for their livelihood. As a matter of fact, 80% of the population are in the agriculture sector. As such, food security in Malawi not only affects the population's well-being, but also plays a crucial role in the country's economic stability and social development. Despite challenges being faced, Malawi is proactive in implementing harm reduction strategies to tackle these pressing issues of food insecurity as well as nutrition. Some of the strategies that we have put in place are as follows. Firstly, we are diversifying our agriculture sector. While we are traditionally relying on staple foods such as maize consumption, we are encouraging farmers to diversify their crops so that they reduce the vulnerability to crop failures caused by climate change, pests, and diseases. We are also promoting cultivation of more resilient as well as nutritious crops that can enhance food security and nutrition. Secondly, we are investing in infrastructure, which is going to help us to have more irrigation systems. For example, we're investing in what is going to be one of the biggest irrigation schemes in Southern Africa, the Shire Valley Transformation Project, which at the end, next year in December, will cover over 40,000 hectares under irrigation. This will help to improve crop production, access to water sources, access to markets for income generation, as well as reduction in post-harvest losses. Thirdly, we are promoting climate-resilient farming practices in our smallholder farmers. Climate change, as we all know, poses a significant threat to agriculture in Malawi and across the world. The evidence is the recent cyclone Freddy, which took hundreds of lives in Malawi in March this year and damaging about a third of our country. We cannot forget the devastation that this cyclone caused as a result of climate change. But we are also proactive because we're encouraging our farmers to adopt climate-resilient farming practices, such as planting drought-resilient crops, and also efficient water management and conservation agriculture to mitigate the impact of climate-related changes. Fourthly, we are making it easy for our farmers to access technology and credit. Many smallholder farmers in Malawi lack access to credit and modern farming technologies like other countries. As a government, we are providing these financial services and access to innovative farming tools that can empower these farmers to increase their productivity as well as income. We're also looking at social safety nets as a way of helping these farmers to have access to financing to buy necessary needs on a daily basis. We're implementing what we are calling the social cash transfer safety net programs to help these vulnerable households to cope with food insecurities during times of crisis. These programs, they provide the safety net for most disadvantaged individuals and families, especially in the areas where there's flooding as well as drought. And sixthly, we're empowering local communities to take charge of their food security through community gardens, as well as having seed banks, and have collective farming to be effective in addressing hunger at the grassroots level. That is why we have a lot of irrigation schemes, and we keep on developing these irrigation schemes, which are run in a cooperative format. But we do realize we cannot achieve food sufficiency as well as nutritional needs on our own. That is why Malawi is looking forward to a collaboration with other African countries to enhance food security and nutrition security. This would be possible through strengthening trade information sharing among African nations and be in forums like these ones where we can learn what other countries are doing to address these needs. But we can all agree the fact that food security in Malawi and across the world is a complex issue that requires multifaceted approaches. Harm reduction strategies must focus on sustainable and resilient agriculture practices, infrastructure development, and social safety nets, among others. By working together at national, continental, and global levels, we can embrace a shared responsibility to shape the future of food security for generations to come. I wish you all the best. May the Lord bless you. I thank you.
Merci infiniment à Monsieur le Ministre et je vais appeler sans plus attendre Monsieur le Ministre, Monsieur Douglas Mombeshora, Ministre de la Santé du Zimbabwe. Merci.
Thank you, Moderator. Let me start by recognizing the Minister of Health for the Kingdom of Morocco, and I would like to say thank you very much for inviting me to this important conference. But before I proceed, I also want to add my voice. My sincere condolences to the people of the Kingdom of Morocco on the loss of their beloved ones during the earthquake that took place recently. I don't want to, because for the sake of time, to spend time on talking about some things that you know already. But let me say harm reduction refers to policies, programs, and practices developed to reduce harm by minimizing adverse health, social, legal, economic, and even environmental consequences of human behaviors and activities. Therefore, on tackling this issue of harm reduction, we should be looking at the areas of policies and programs that we develop as countries to mitigate against the effects of climate change and the attaining health challenges. Let me start by talking about the provision of safe water. Sustainable Development Goal number 6 calls for universal and equitable access to safe, affordable drinking water. I will dwell more on how Zimbabwe is tackling some of these challenges. On the situation in Zimbabwe on water, all urban areas use water treatment reticulation systems. But of late, due to increase in urban population, rural-urban migration, the facilities in urban areas are now overwhelmed, and some of the systems are outdated, and we've seen shortages of water, clean water in urban areas. And government has initiated 2 projects. As a short-term project, they are drilling boreholes in those areas affected by shortage of water to make sure that there's clean water. And then they've started constructing 2 dams to augment water supplies in urban areas, especially in the capital, Harare. There's also what has been termed Presidential Borehole Scheme, which aims at providing clean water to the country's 35,000 villages by 2025. And this is spearheaded by the Zimbabwe National Water Authority in partnership with contracted private partners. The aim is to make sure that every village will have a borehole by 2025. And these boreholes are also going to be solar powered. And at each borehole, there's going to be a 1-hectare nutrition garden, which is going to be used by members of the village around that borehole. So it's a combination of tackling the challenge of malnutrition in the rural areas, as well as supplying fresh and safe water to the villages. Currently, 82% of the population in Zimbabwe, in both rural and urban areas, has access to protected water. However, the supply of water in some urban areas is fraught with lack of water treatment chemicals and systems breakdown, as I have mentioned, and inadequate water reservoirs, therefore affecting the goal of a sustained and constant water supply. Some cities have started using water rationing as a measure to ensure the availability of treated water to its citizens. Some informal or illegal settlements also pose a challenge, as most of them don't have access to improved sources of drinking water than other residents. Our ministry is also inspecting water sources to identify possible sources of pollution or contamination. We are also tackling the protection of water sources, especially in the rural areas, because you'll find that some of the reservoirs are now being used by animals as well for drinking. We have embarked on protecting the freshwater sources by fencing them out so that only humans can access the clean water, and water for animals can be pumped to drinking places. We have reticulated systems used in some urban areas. There is also water quality monitoring. Water quality monitoring is done in both rural and urban area. Institutions that are focal in water quality monitoring include our environmental health agents, the government analyst laboratory, and local authorities have got also their own ways of monitoring the quality of water. In this area, we face challenges that include inadequate water testing kits and consumables. We have water quality monitoring, which is used as a tool for surveillance and risk assessment. In Zimbabwe, we have had cholera outbreaks in some parts of Zimbabwe. And currently, as I speak, we've got one district which had an outbreak about a month ago. We have realized there are challenges in water supply in areas where we get these outbreaks, and mainly in the rural areas. And also in those areas, we've seen that people are still using river water, even for domestic use. We have also had challenges with typhoid in some parts of our rural areas. The ministry is working with various partners in providing water treatment kits at community level to make sure we deal with these outbreaks. And that's a health challenge, which we feel in the near future we will be able to overcome it. The environment issues. Human beings are dependent on the environment they live in, even though it seems that humans in this century, all over the world, are more connected to technology than to the environments that surrounds them. Changes of the climate will also have an effect on the way illnesses are transmitted and cause a number of extreme weather events which can have extremely dangerous consequences on human lives. Poor people have always been very dependent on weather and environmental conditions. Health professionals have an urgent responsibility to ensure that the health benefits of environmental policies are understood by public and by the policymakers. Environmental risks to health include pollution, radiation, noise, land use patterns, and climate change. Our country is mitigating the effects of climate change through implementing smart technologies. That is, use of solar systems, use of hydropower, sanitation technologies, and new waste management technologies that reduce pollution. We also tackle air pollution. Through the Ministry of Health, it is supposed to monitor ambient air quality, but we face challenges of inadequate resources to do that. Only one city in Zimbabwe is currently using the Ringleman's chart. Our capital city, Harare, is stopped due to obsolete equipment. We also have a challenge of managing healthcare waste. My ministry, with the assistance of partners, is providing incinerators at health institutions to control disposal of health waste. We've got 5 central hospitals, which are hospitals with more than 1,200 beds. And at 2 of these institutions, we are building new incinerators with capacity to handle 150 kgs per hour of healthcare waste. At the smaller district hospitals with a bed capacity of between 80 and 120, we are also constructing other incinerators which are smaller but capable of handling the health waste at that level. Coming to sanitation issues, the rural sanitation coverage is at 38% in our country. Open defecation stands at 37% for both rural and urban areas. Use of bush for sanitation promotes spread of diarrheal diseases. The country needs an accelerated sanitation program. The ministry has finalized drafting a sanitation and hygiene policy which should guide the WASH, that is water sanitation and hygiene sector, in the implementation of sanitation programs. WASH in healthcare facilities. The ministry has adopted the implementation of WASH in healthcare facilities to minimize the transmission of disease in healthcare institutions. UNICEF is mobilizing funding for the program, which started in 4 provinces. We have got 10 provinces in our country, but we have only started in 4 provinces, 2 of them being metropolitan provinces. The program will extend to other provinces very soon. We also need to manage our hazardous substances. It is thought that reenacting the old act that we had is going to be able to enable us to manage the health care as outstanding in the current Environment Management Act. Let me come to talk about the food security. Poor production, processing, and consumption of food are all associated with diseases and the associated health, psychological, and economic burdens. These include the exposure of agri-food sector workers to occupational hazards, e.g. pesticides or pathogens, as well as diseases associated with agriculture, e.g. antimicrobial resistant pathogens resulting from the use of antimicrobials in food animals and pandemics emerging from intensively kept genetically similar livestock. As Minister of Health and Child Care, we are registering new products so that they comply with our safety regulations and standards. Food is monitored in the market and premises are licensed. All food imports are monitored to ensure they comply with our laws. The ministry is also carrying out market surveillance to ensure food in the market complies with our regulations. The ministry is working with other ministries to promote the farm-to-fork concept in food production and engaging in phytosanitary activities for imported and exported foods. Lastly, let me talk about nutrition. Nutrition in the under 5 age group. Following interventions are in place. In the community, we have what we call village health workers who are trained in infant and young child feeding, as well as counseling. These village health workers also train mothers to support infant feeding. And the same village health workers do active screening for acute malnutrition. Other infant and child feeding at primary school care facilities are also monitored. We have got baby-friendly hospital initiative to promote breastfeeding. In schools, we have adolescent nutrition and feeding programs. The ministry promotes infant child feeding through exclusive breastfeeding, baby-friendly initiatives that provide support to the mother and baby, but it covers postnatal care. Thank you very much for your time. I thank you.
Merci beaucoup, Monsieur le ministre de la Santé du Zimbabwe. Sans plus attendre, je donne la parole à Madame la ministre Halima Anima, ministre déléguée de la Santé au Malawi. Merci, Madame la ministre.
Let me recognize the presence of the Minister of Health and Social Protection from Morocco, and also the Minister of Agriculture from Morocco, all ministers present here, the African Global Health President, all distinguished delegates, ladies and gentlemen. Assalamu alaikum. Good afternoon. Let me also express my deepest condolences to His Majesty the King Mohammed VI and the people of Morocco for the great loss incurred during the disaster. Ladies and gentlemen, it is a great honor that I stand to make contribution to this prestigious gathering about the important topic of global health interest. Ecosystem is about interaction of biological systems and the environment, the relationship between health harm reduction and the ecosystem of the future in interdependent. The two share common principles and objectives that are crucial to human well-being. Harm reduction principles have been successfully applied in various public health contexts globally, from sustenance abuse to sexual health, aiming at minimizing harm. On the other hand, the ecosystems are facing numerous threats, mainly due to human activities, that is habitat loss, due to urbanization, agriculture, deforestation, pollution stemming from industrial processes, and transportation. These effects have not spared Malawi. For instance, a major cyclone Freddy hit Malawi early this year, and it caused a lot of damage. Over 2,267,458 people were affected in the 14 districts. 2,178 injuries, 676 deaths, and a total of 659,278 displaced. This caused significant disruption to health services delivery and access, increased disease burden, and loss of health regards. The ongoing cholera outbreak with over 58,992 confirmed cases to date, and a death toll of over 1,768 cases across the 29 districts is another area of public health concern. Our ministry is up to date, still recovering from the consequences. Applying harm reduction measures in ecological context is vital for a healthy sustenance ecosystem of tomorrow. This includes pollution control, sustainable resource management, climate change mitigation by reducing green gas emission through transitioning to renewable energy and adoption of sustainable transportation options. Some harm reduction strategies our ministry is emphasizing on are proper disposal of medical waste through installation of high-tech incinerators in our health facilities, and installation of solar electricity in rural facilities. This is a call to government, institutions, and regulatory bodies to strive to advocate and drive implementation of harm reduction to ensure a healthy ecosystem of tomorrow. To achieve this, it requires commitment and continuous resource mobilization. A good, healthy ecosystem is essential for the well-being of all of us. Lastly, let me also thank the King, Mohammed VI, and the government for hosting this very important conference. I thank you all for listening. Thank you.
Merci infiniment, Madame la Ministre. Merci à Mesdames et Messieurs les ministres pour ces interventions extrêmement riches et qui montrent à quel point aujourd'hui l'Afrique marche main dans la main afin de pouvoir se projeter dans le futur, main dans la main gouvernementalement parlant, mais aussi avec les experts. Sans plus attendre et pour ne pas retenir, Mesdames et Messieurs les ministres, je vais demander au docteur Tendai Mirza de venir sur scène pour lire la résolution qui a été rédigée et travaillée pendant toute cette année avec les experts d'African Global Health, donc les experts de toute l'Afrique, avec également l'intervention de nos experts et ambassadeurs d'Amérique du Sud et d'Asie qui ont aussi demandé à avoir un point concernant cette résolution, qui est un projet de résolution qui est soumis aux différents gouvernements, puisque African Global Health aujourd'hui est accompagné d'Africa CDC et de l'Union africaine pour pouvoir demander cette charte panafricaine. Donc sans plus attendre, je donne la parole à Madame Tendai Mirza.
Sorry. Okay, so as promised, I'm back to read the Marrakesh Resolution. Africa leading global healthcare. African global health, with the support of the African Union and the Africa CDC, aims to empower Africa to take the lead in spearheading South-South initiatives aimed at collaboratively achieving health sovereignty in Africa and throughout the world. This will be achieved through health harm reduction with a particular focus on water, environment, and food security in line with the relevant SDGs. With a commitment to collaboration, innovation, and equity, we envisage a future where African nations can, not only achieve universal health care, but also contribute their expertise and resources to uplift health systems across the global South. So this conference will produce a declaration on these issues that will serve to pave the way towards the following 5 resolutions. Resolution 1, to promote strong collaborative work under the stewardship of African leaders and experts, both public and private, progressing African health development. Resolution 2, to create a common solidarity movement in which South-South expertise is mobilized and shared for continental sovereignty in health management. Resolution 3, to foster collaboration and thought leadership between African countries to create unified Pan-African evidence-based health policies and disaster preparedness frameworks, and application of technology and innovations. Resolution 4, to adopt a Pan-African Charter for health harm reduction that incorporates medical, social, economic, and psychological factors related to population health in diverse African communities. And the last resolution, to enable the fruitful and intensive joint work streams between experts from Africa and other continents open to establishing partnerships and global health bureaus. Together, we will forge partnerships, invest in health infrastructure, and leverage our collective knowledge to ensure access to quality healthcare as a universal reality. Africa's leadership in this endeavor will be a beacon of hope and progress, fostering a healthier and more equitable world for all. Thank you.
Merci, Dr Mirza. Alors, à ces fins, nous avons eu un petit chamboulement de programme. Il y a un plaidoyer sur la souveraineté sanitaire en Afrique qui a été co-dirigé. Je vais demander au professeur Taker et au professeur Chetty de me rejoindre. Nous allons en parler très brièvement en 3-4 minutes pour ne pas retenir messieurs les ministres. Ce plaidoyer est écrit par 43 experts africains, avec toujours un clin d'œil à l'Amérique du Sud et à l'Asie, pour parler de souveraineté sanitaire en Afrique. La souveraineté sanitaire, le plaidoyer est co-dirigé par le Kenya, l'Afrique du Sud et le Maroc, avec 43 pays représentés, dont africains. Et aujourd'hui, nous parlons de souveraineté sanitaire et l'Afrique tend la main au monde, tend la main c'est vrai qu'on parle de la première conférence Sud-Sud, donc à l'Asie et à l'Amérique du Sud, mais aussi au monde entier, puisqu'il y a plus de 83 délégations aujourd'hui. Et donc, j'aimerais qu'on projette, s'il vous plaît, le plaidoyer qu'on signe tout à l'heure. Donc, souveraineté sanitaire, le plaidoyer l'advocacy va être signé tout à l'heure et distribué aux différentes personnes qui seront présentes. Le professeur Chetty d'Afrique du Sud, qui a co-dirigé le livre avec moi, et le professeur Taker. Je ne sais pas si messieurs les ministres nous permettent de leur donner 1 minute chacun. Merci infiniment. Merci. Si on peut vous avoir, s'il vous plaît, pour parler de cette aventure d'une année. Alors, dans l'advocacy que je co-dirige avec le professeur Chetty et le professeur Taker, dans ce plaidoyer, il y a 43 expertises différentes. Il n'y a pas des experts et des économistes, il y a des politologues, il y a des experts en santé, et c'est un cri ouvert post-pandémie à la solidarité, à la fraternité, à la responsabilité, aux valeurs de l'Afrique, aux valeurs Sud-Sud, de mettre main dans la main et de travailler ensemble. Donc, sans plus attendre, je donne la parole au Dr Taker.
Thank you. Thank you. Good evening, ladies and gentlemen. On behalf of Professor Chetty and myself, we would like to take just a few minutes to talk about One Africa and the book that we've written on solidarity. Let me first begin by thanking the distinguished ministers on the panel today. Let me also give a very warm round of applause to the Minister for Health, Khalid El Taib, to welcome us here. Under your leadership, Minister Khalid, and through the dynamic work of Imani Kendil, let's also give her a round of applause. She's been working so hard with all her team from AGH to make sure that we are all here. Honestly, let's give them a big round. I can see Leila, Sarah, I can see everyone who has worked hard. 83 countries were present here today. One more day to go, Honorable Minister, before we finish the AGH. And this is all about One Africa. It's all about partnership. Africa is at its inflection point today. Never ever has Africa reached such a turning point, with very able leaders like yourselves, many leaders who are here today, and many young people watching us to change Africa's direction right now. In the last 2 years, Honorable Minister, in New York at UNGA, we have had the discussions about Africa being the center of change. What came out in last week? Africa is young, Africa is dynamic, and the most important, Africa is unstoppable. Africa is unstoppable. In the unstoppable Africa, Honorable Minister, we have shown that $259 billion worth of opportunity in health and life sciences are going to be unveiled in Africa in the next 10 years. This is only second to United States. Let me give you another definite discussion we had. $1.3 trillion are needed for us to achieve SDG. And this makes Africa a central discussion globally. But not everything is well, Honorable Minister. And we discuss many of those things in the book. One is I don't think we are getting a fair seat as Africans in the global stage. Everyone here present today, Mr. Minister, is here because they believe in Africa, but we need to move Africa to the next level ourselves because nobody is going to do it for us. If we don't do it, nobody is going to look after us. Let me give you 2 or 3 examples that is affecting healthcare and what is affecting us in our continent. Are we looking for fairness? Yes. When any African countries goes to borrow money from the financial global architecture anywhere in the world, you are charged 6 to 8 times more than your counterparts from the developed world. Is that fair? And that is not fair because when the cost is higher, it is being transferred to everybody on the streets. We only want to do 3 things as we look at being fair and being ready for changing Africa. I will just mention 3 points. One is Africa reform. The second is Africa reposition. And the third is Africa reinvented. One of the things about Africa reform is we wait in many lines. Every one of you has waited in lines. You waited for your line for your passport. You waited in line for your vaccines. But let me tell you the biggest problem of the line. The lines between our countries. The lines between our countries are called borders. Mr. Minister, we have 54 countries. And this is created a broken Africa. We must remove the lines. We must remove visas. We must have free movement of goods, labor, and services. Why should Professor Rogo be stuck in Istanbul because he didn't have a visa to come to Morocco or to come to any other country? Let's remove visas so that we can be united. In China and India, where we have similar population, 1.3 billion. In China, Honorable Minister, you need 1 license. In India, you need 1 license to have some business. In Africa, you need 54 licenses. This is created by us. And then the broken Africa is what we need to reform. The second is Africa position. We contribute most minimally to climate change damage. Africa produces the most minimal damage. Africa is clean. It has the highest sources of renewable energy. Africa also provides the natural resources that we have. Then why do we have to beg for donor money to enable us to buy ARVs and vaccines for our people? We can change the narrative by repositioning ourselves and allowing us a seat like we saw at the G20 so that we can produce our full potential as Africa and demand our rightful position on decision-making organs, and we are not left behind in the queue waiting for donor funds. Honorable Minister, I appeal to all of us to move from donorship to ownership. That is where Africa is going to prosper. That's my number 2 point. My final point, my last point, is we need to reinvent Africa. It's the time when the Asian countries are taking wonderful power. If you look at the BRICS summit, you saw the GDP. You can see the children of Asia are rising. You can see the companies of Asia are rising. Africa is next. Within the next, Honorable Minister, 10 to 20 years, we need to dominate the economic powerhouse. We need to build the economy for tomorrow. That means we have to adopt artificial intelligence, digital solutions. We need to decide on what the youth need. The children of Africa is today, whoever is in between their adolescent age are the ones who are going to drive the next economy. We should use the resources and the people in Africa to reinvent Africa. So between Africa reform, Africa reposition, and Africa reinvented, I think we should be a winning formula. Thank you.
Thank you, Dr. Tucker. Merci beaucoup. Merci au Kenya. Je vais donner la parole à l'Afrique du Sud. Professor Shetty, but be short, please. Not like him.
Thank you very much. I think Dr. Tucker has said everything he should. I just want to say three things. One is, I think Africa, as for too long, we've clung to the colonial legacy, and that's put us backwards. We must rid ourselves from the colonial legacy. I think the solutions from Africa must come from Africa. And I think what we emphasize, and all the chapters in the book, you would see the issues in Africa is everybody's business. And we must do it together. Thank you.
Thank you, Professor Shetty. Comme nous l'avons dit, il y a eu la déclaration de Marrakech de novembre 2022 qui a été lue à 2 reprises lors d'un travail à Johannesburg et à Cape Town. Nous voulons partager du nord au sud et du sud au nord. Aujourd'hui, les frontières d'expertise sont levées. Nous remercions mesdames et messieurs les ministres de leur patience. Merci de leur support. Et merci aujourd'hui de tendre la main aux experts. Merci infiniment. Et tout ça sous la vision éclairée, avant-gardiste et toujours vers l'avant de Sa Majesté le Roi Mohamed VI, que Dieu l'assiste et le glorifie. Merci infiniment. Ne quittez pas la salle, s'il vous plaît. La séance n'est pas terminée. Nous avons une séance avec les experts tout de suite, s'il vous plaît, et les recommandations. S'il vous plaît, on reste dans la salle, s'il vous plaît. Il y a encore une session. Je vais appeler les prochains panélistes, s'il vous plaît.
أرض الراس لي غي العيار يطبل ذا الغضاء وسنان وكيد يعدان يفرنتي سوراه فكرني دغر ومنار يوثي يدي طيش سلن وفي غسل غاشي عمار الراني يا رسال أبراحي هكي ثمغرة سوز قرر ذوررن سفدني يدي والخيال سشاش الزواغ.
Est-ce que ce monde est sérieux? Andalousie, je me souviens, les prairies bordées de cactus. Je vais pas trembler devant ce pantin, ce minus. Je vais l'attraper, lui et son chapeau, les faire tourner comme un soleil. Ce soir, la femme du torero dormira sur ses deux oreilles. Ruiza guida porro.
Est-ce que ce monde est sérieux? أقول له ورد صوخر على ينسيه ونيضو ميسو ما يدا طرزا أنت كن وريد شدو.
Ils sortent d'où ces acrobates avec leurs costumes de papier. J'ai jamais appris à me battre contre des poupées.
Il y a un dîner de gala offert par Monsieur le ministre de la Santé et Monsieur le ministre de l'Agriculture ce soir au musée de l'eau. Il y aura des bus devant l'hôtel pour conduire tout le monde à 19h30. Dîner de gala au musée de l'eau. Ce soir, offert par Monsieur le ministre de la Santé et le ministre de l'Agriculture. Merci infiniment. 19h30 au hall de l'hôtel. Merci.
sango solo